Today on the podcast, we have one of the warmest, most compassionate doctors. We also have someone who's an authority in her field. I've also have the most respect for her as not only an IVF and fertility care in India, being a most respected name in that field, but also a gynecologist, also as someone who has been the hope for thousands and lakhs of couples who wanted to have children. I represent and I respectfully introduce on our podcast Dr. Nandita Palshetkar. Dr. Palshetkar, thank you for being with us. It's a pleasure to have you on the show to understand from you what really drives you, your passions, and also the people you have helped. But I also today want to ask you the questions that are there in every young girl on her infertility. I'll begin at the very start. I want to first ask you about your journey. What drove you to take on this particular fertility stream?
I think if you look at it, when I was a child, my father was someone who always helped people. There were lots of people who always came to him for assistance. And, as a child, I was thinking that how can I help people? And I think that's what drew me to medicine, through healthcare. And I decided I wanted to go there and I wanted to become a doctor so that I can really help people. And then I was doing gynecology. It was a no-brainer. I wanted to work in women's health. So I was doing gynecology and, rhythm in the OPD, I had two sets of people who used to come to me, maximum. One set which came with, we are pregnant but we don't want the baby. And the other 50% would say, oh my God, we want a baby, we can't conceive, we are dying for it. And I used to really feel that, somehow or the other take this baby and give it to the person who wants it, kind of. And that is what drove me over there, seeing the anguish, seeing the hope. And it was a field which was very daunting, which was upcoming. And I could foresee a lot of advances that were going to happen. And it was very exciting to be there and to go there that way, And actually in the late 80s, when I actually decided to go this way, it was not very popular. It was something that was, surgery was very popular. You had fantastic surgeons. So it was like, surgical technique versus technology. Then the road less traveled. Everybody was talking about contraception, family planning was in a big way. So infertility was something that was not really everybody's concern. But I decided to take this route because of the patients that I saw in my OPD. And the anguish, the angst really, edged me on.
When was it that you realized, Dr. Palshetkar, IVF is going to change India and these couples in their lives forever?
The first time I did a simple treatment in JJ Hospital. And that couple conceived after many years of infertility. Right. And they came back and they actually, treated me like God. I mean, I'm a human being. To get that kind of, response from the couple was really unnerving to say. And then I realized that how desperate they are. And that's when I decided that, this is what I want to do and this is what's going to change. Because 1978 was the birth of the first baby and you won't believe it, there were thousands of attempts made. Success rate was only 1% and the success rate was growing by leaps and bounds. And I knew that this will really today, achieve something great with the technology advancing. We knew computers were coming in and so many new things were coming in. Yes. So it was very exciting phase of IVF actually when I entered.
And why do you think even today, Dr. Palshetkar, infertility is treated as a taboo topic?
Our society is very, narrow-minded or whatever.
Yes.
A woman is considered a woman only after she gives birth. She may be the top CEO of a company and everything, but has she become a mother? I think the patriarchal society that we live in,
yes,
it needs to, undergo a change. And I think in a way also, women's traditional role has always been the caregiver, the caretaker. So in that sense, the women feel kind of stigmatized. And in the olden days, there were a lot of stigmas attached to not having a child. They were not allowed to come into functions. They were not allowed to do certain rituals, So I think all that really causes a stigma. And of course, today, the generation is really changing. I mean, I feel that they're much more open, they talk about it, so it's there.
Is it still taboo?
Yes, actually, what I'm talking about is maybe 10% of the population who really talk about it and they don't care.
Yes.
But 90%, yes, they send me patients and they will tell me, please don't disclose it, that kind of a thing. And I respect that because they have to live in that society and they don't want to probably, talk about it.
But in your vast experience as a gynecologist, as the foremost authority in fertility in India, do you think infertility, ma'am, is on the rise?
Definitely, yes. I think there are many, in fact, there was a WHO statement which came out in the late 20s that the infertility incidence is 17.5% in LMICs. It's so high. So every one out of, we used to previously say 5 or 6 patients actually is infertile. And we are seeing it rising because, first of all, the awareness has increased. Secondly, girls are getting educated, they're delaying childbearing, they're getting married late. So again, as you're aging. Then a third also, sexually transmitted diseases are on the rise, and people are having unwanted children and they are going in for abortions. Sometimes that also can cause infertility. And another thing which I've noticed is, I think because of the pollution, the contamination, we are seeing a lot of young girls with accelerated ovarian aging. The girl may be 28 years old, but her ovary is 40 years old. So it's really very traumatic, and there are many reasons which you're seeing for this, but these are some of the reasons. And of course, lifestyle factors, especially in the men, even girls, smoking is not good for girls or for her male partner as well. So I think smoking, alcohol, recreational drugs, all these definitely have added.
Also surrogacy, we've seen Preeti Zinta, Priyanka Chopra, all the actors have taken note of it, whether it's even Shah Rukh Khan, Karan Johar. Why is it banned in India today? Do you think that's a right step?
See, surrogacy actually is meant when the girl cannot conceive. So I think our Indian mentality was really in that sense that you don't want it to become a lifestyle option. Because see, pregnancy comes with its own complications, with its own problems. And just because you don't want to get pregnant, you're putting somebody else at risk. That is the point that was not acceptable to a lot of people, I think. So if a surrogacy is indicated, yes, I think it is fantastic. And that is what the law is actually, it's getting more streamlined. But as any law, even our MTP law which came, it was so stringent initially. Today now you can do MTP at any stage of your pregnancy. So I think the surrogacy law is also going to change. And it is done for indicated because of this reason. And maybe I don't know. I'm like in a way happy that it is there because yes, I see the downside of it. But on the same side, it's women's right.
True. And Dr. Palshetkar, is IVF a treatment that is there only for the rich, or even the middle classes can go in for it?
Now here I really want to change your concepts. Okay, today IVF has come about, I think, 1978, so nearly 40 plus years, okay? And things have changed. When I began IVF in the 90s, early 90s, we used to make our own pipettes, we used to make our own media. Media is the stuff baby is grown in, cultured in. So we used to make that on our own, and now everything is ready-made. I tell you, this generation is very lucky. But then, of course, it's the hard work which has come through.
Yes.
And all this now is made in India. A lot of it. So the costs have come down. The drugs especially are made in India, and they're very good. The costs have come down. So yes, okay, there are 3 tiers of IVF centers which are there. One is the ones with the army, the ones with the medical colleges, the ones in municipal and government hospitals like AIMS, DY Patil, etc. Those are the ones which have really low budget IVF, and they do help patients. They get medicines at a lower, cheaper cost. So it's very, very accessible. The second group is private practitioners who offer budget cycles. They also do their bit. See, because I think in India, you have to have a mixture of both.
Yes.
So yes, you cater to the uber rich, and you also cater to the other people, because health is something that should not be denied to anybody.
Lovely.
So I think everybody is working towards that.
So
and as doctors, we do a little bit.
That is really nice to hear, because especially coming from you, because I've heard that you're one of the finest doctors who goes out of the way for the patients. Even when it comes to Dr. Palshetkar, genetic testing of embryos, is this to prevent illness, or is this for a lot of couples to have a designer baby?
That's a good question. I think when it came, there was a big hoo-ha about being a designer baby and all. But trust me, PGT is what we call it. That is a pretty invasive test. Okay, we take this baby and we take out about 10 to 15 cells from that embryo.
Right.
And then that is subjected to testing. So nobody takes that very easily, especially we doctors don't jump to it immediately. Okay.
Yes.
And it is for diseases. I've had a patient with thalassemia-free babies born, sickle cell-free disease born. Then there is a patient with hemophilia. We've done the testing of the babies, and the child doesn't have hemophilia. So I think it's very, very important to have this technology. It's a technology which is useful. And yes, as everything goes, you could probably down the line, select the genes which you want. And in fact, there is there's a genetic company in America which actually gives you intelligent quotient also.
Gosh.
Yes, but those are different things where you can actually select a baby with less chance of cancer.
Oh,
in the future. So
Lovely.
there's a lot of things happening on this front.
What is the hardest part of being an IVF doctor?
The hardest part is when a patient's cycle comes negative. Trust me. It is really heartbreaking, not only for the patient, but also for us, because we want to make everybody pregnant.
That's lovely.
But of course, the success rates are that much only,
Yes.
whatever we try and do. But really, I think, I began in 1990s, and now the success rate has jumped. It's, it's great. It's a pleasure to be in this field.
What is the success rate, ma'am?
Wow. Actually, if you go to see in a girl who is young, 35 and under is young,
Yes.
it's about 50, even 60% at times.
Lovely.
And in older, 40 plus, it definitely drops. Anything from 10 to 30%. So yes, but I have a lot of girls who want their own eggs, and we do give them a shot, and exciting things happening.
So what is the biggest myth about IVF that you would want busted?
Most of the patients initially used to come to me and say, is it going to be our child?
Yes.
Because they're worried whether it's a donor sperm or a donor egg or something.
Yes.
I think IVF is what you want, and what we do is, the challenge for me is to give you a baby with your own gametes.
Yes.
And that's the part of IVF that I like.
Yes.
So I think it's taken a lot of years, and we have to explain to them.
One fertility tip you would like to give to every woman below 30?
Please do your AMH, serum AMH. That is a test to know how is your ovary aging.
Right.
And I think it's very, very important.
Right. Is infertility, ma'am, more in men or women?
Actually, it's equal. 50% is female infertility, 50% is male, which is responsible for the infertility.
Right.
And sometimes both are responsible.
Okay.
10% is the unknown factor.
Okay.
But yes, they're equally responsible.
Right. A lot of people say that infertility is not a woman's problem alone. 50% of the time, like you said, it can also be a man's problem. But what about the smaller villages, smaller towns? Is that accepted there?
You'd be surprised. These days, I get video calls even from the remotest part of the country.
Wow.
So we do video consultations and the man comes.
Oh, lovely.
A lot of time the man is on the call asking about things. But it's usually when there's a male factor infertility. But I think the awareness is definitely there now that both should be investigated together.
Yes.
So yes.
Do you feel egg freezing is today no longer only for celebrities but for every young woman?
Hello, I get at least 3 to 4 patients every week for egg freezing.
Amazing.
It's women empowerment. I think it just gives you that confidence that you can go ahead, you can, wait for childbearing.
Yes.
Though my advice to everybody is have a child as soon as you can, before 30 if possible.
Yes.
But if that is not possible due to other reasons, do egg freezing.
Yes. Stress, lifestyle, fertility. How much does stress contribute to infertility?
Actually, the studies which have shown doesn't really contribute. Okay, but I feel if a woman is mentally at peace, she is more, so we do a lot of therapy, we advise mental therapy,
Yes.
so that it takes the stress away.
What is the emotional trauma about infertility that no one talks about, Dr. Palshetkar?
It is traumatic, and sometimes if I ask directly to the patient, are you depressed or they don't like it. So I've really learned it along the way in my 30 plus years of practice that you have to just chat and listen to them.
Yes.
But yes, there is anxiety. Anxiety is maximum. Anxiety is maximum, and self-image also.
Yes.
That. I don't know, it's really very complex, and you really need to be listening to the patient, talking to her and getting her confidence. I think that is what is important.
I think being an IVF fertility doctor and a gynecologist is not only about doing the procedure but also somewhere being a psychologist because you're helping them.
My God, you hit the nail on the head because, the law came and they said you need a counselor, you need a therapist, which is important. And that's what we were saying. All these years, we are the counselors, we are the therapists.
Yes.
In fact, there are a lot of time when during consultation, I'm chatting with the patient and I said, I'm not doing anything except giving you therapy right now.
Yes.
So, we have to do that.
And coming from an authority like you, I think a young woman would just be more encouraged rather than someone else telling.
Absolutely, absolutely.
So,
I think it has to be tackled very delicately. Not even me. Trust me, it has to be very delicately handled.
Science, in a way, it said Dr. Palshetkar has today given women the right to be mothers when they choose. Is that accurate?
Absolutely, actually.
That's amazing. That's women empowerment, like you said. And in this century, it's extremely crucial. Not only things like AI and technology, but IVF is a great tool, especially for women, like egg freezing, like you said. I meet a lot of young 25-year-old women who've actually taken the decision to freeze their eggs.
Absolutely. I think, in fact, I was talking to another doctor the other day and I said, if I had a daughter 26 years old, I would just, freeze because the quality is age. Age is quality.
Yes. Even without marriage, you would advise that for your daughter?
Of course, without marriage, I think, because see, by the time, then there's no pressure to choose the right person. Supposing that's time, you're not finding the right partner.
Yes.
You're under pressure because bachcha nahi hoga.
Right.
So you should freeze eggs, I think, right partner, whether career, whether education, or it's just not the right time.
Of late, some celebrities have spoken about the pain they went through due to egg freezing. How accurate is it? Is it a simple process?
Actually, IVF has become very patient friendly and egg freezing is part of the IVF process. Yes. So, things like, simple things like you have to take injections.
Yes.
So, yeah. But now those injections, hair, the needles are as thin as the hair.
Amazing.
So, and you can self-inject. Then sonography, blood tests were numerous, which we have totally eliminated. We just do ultrasounds.
Yes.
So, those things, and I think a lot of talking, empathy to the patient, connecting with the patient, making them feel that it's a breeze.
Yes.
That really matters.
Most definitely. Several actresses from Ekta Kapoor to Priyanka Chopra Jones to Shilpa Shetty have spoken about IVF and surrogacy. Do you think this will make the younger women feel less judged if they go in for such procedures?
I think it matters. These are influencers and they are having a positive influence. I think that really helps. Talking about the procedure, which is, as you said, stigmatized.
Yes.
When they come out and speak about it,
Yes.
there's no longer a stigma attached to it.
That's right. Are young women in India underestimating how quickly infertility will come?
Yeah, quite a lot. Because, there was a very beautiful study which actually says that the Asian population ages Indian women per age 7 years faster than their Caucasian counterparts. So we don't realize it, but it's probably the pollution, the contamination, and other genetic factors as well. And so girls should be aware that aging does occur in our country and we should be totally aware of it and forget about only children. I feel even in the other aspects like bone health, the cardiovascular health, etc. All of them. In short, the menopause age is coming closer.
Right.
And that is a little worrisome.
So do you think, Dr. Palshetkar, infertility is going to be India's next big public health crisis if young people don't act quickly?
Definitely, yes. And I think there are many factors, like even obesity is adding to it.
Yes.
Those who are obese in their teenage years,
Yes.
they land up in the infertility clinic 20 years down the line. So I think all these factors are definitely. Another thing is the fertility rate of our country has dropped.
Yes.
Okay. Right now you won't see it,
Yes.
but 20 years down the line, we will not have younger people. And then I think these technologies actually might just help them to have babies. So I feel those who want the children, this technology should be available because we are going to suffer from this reduced fertility rate decades down the line. So IVF should become one of the ways to bring joy to their.
I agree. My final question, which case or which baby has been someone that you are most emotional about?
Actually, there have been so many of them. I think, lots and lots of patients. But of course, my first baby,
Right.
Which was, I was a young girl of 27 years old, Rhythm. And this patient came to me and she trusted me with her, case and she conceived and this boy has become a doctor today. In fact, I just spoke to him 2 days ago.
Yes.
And it's so satisfying. It's so satisfying. So it's really wonderful. Another person I must mention is Diana Hayden.
Yes.
She came to me as a young girl of 30s and she said, I want to do egg freezing. She's probably the first one in the world to do social, meaning
Yes,
for
yes.
not for any cancer or anything. For cancer, egg freezing has been done before. But she came to me in 2007 and we froze her eggs. And today she's got 3 beautiful children
How
after the
lovely.
age of 40. So it's really, those children, they call me their godmother. And they've given me a beautiful painting with a fairy godmother painting,
How lovely.
But they're really, really, really very close to me. And it's a beautiful thing. So see, she took life in her hand. She got married later on. She could have had natural kids also, but she developed endometriosis. Endometriosis is another big problem in our country.
Right.
And it decreases the fertility. So because she had endometriosis, she used these eggs and wow, voila, I should say.
I think this is an advice that we need to give all the younger women out there. It is time to freeze your eggs. Marriage partner, no marriage partner, marriage on the cards, not. But if there's science out there to help you, it's the time to grab it. And the person to grab it with is also right here, Dr. Palshetkar. You will find her details online. You should contact her. Thank you for being with us, for helping us and the younger women and men understand that there is hope if there's infertility, if they're not able to have a child, and they are not supposed to feel that it's taboo.
Thank you.